Mr. Ross. I'm Alicia. I'm going to be your nurse today. I'm going to wash my hands. I'll pull this curtain closed just for some privacy, okay? How are you feeling today?
Good.
Good. I'm going to take a look at your bracelet here. Thank you. And then if you could give me your name, full name and date of birth.
Dylan Thomas Ross, 12/28/04.
Perfect. Okay, thank you. And Mr. Ross, what is your pain level today from 0 to 10? 10 being the worst pain you ever felt, 0 being none.
0.
Awesome. Okay. And also I reviewed your medical record and it did show that you had a stroke 2 years ago. Is that correct? Okay. And then it also said, it indicated that you have some left-sided weakness from that stroke. All right. And then also, I have here that you have a urinary tract infection, so meaning like you're having some difficulty urinating maybe, or, okay. All right, and then pneumonia. Does that sound right?
Yes.
Okay. All right, and so have you noticed any like burning or pain with urination today? Okay. And what about any breathing difficulties from the pneumonia? No? Okay. All right, well that's good. All right, so today we're going to do a head-to-toe assessment. So what that means is that I'm just going to kind of review all of the areas of your body from head to toe, okay? So that means looking at your eyes, listening to your lungs, your heart, looking in your ears, all that fun stuff, okay? We're also going to get your vital signs as before we start the head-to-toe assessment, and that way those will be done and out of the way. Do you have any questions for me? No? Okay. Does that sound okay for you? All right. Alrighty, sir. So we are going. Oh, I forgot to ask you. Can you tell me who the president is?
Trump.
Awesome. Can you tell me what day is today?
Wednesday.
Wednesday. Perfect. Okay. And can you tell me where we're at right now?
Awesome.
Awesome. Okay. Good. All right. Now we can get started. All right. So I'm going to get your vital signs first. I'm going to stick this thermometer right underneath your tongue. Perfect. All right, so your temperature's good. I'm going to stick this pulse ox right on your finger there. That's going to tell me what your oxygen level is and also your heart rate. All right, so that looks good. All right, so I'm going to stick this blood pressure cuff on here, being sure to really line that up on the brachial artery. Pressure's good. I'll take that cuff off. All right. So I'm going to start kind of with your head here and just kind of feel on your head and make sure there's no lumps or anything like that, okay? At any point in time throughout this whole assessment, if you feel pain, need me to stop, you need a break or anything like that, you just let me know, okay? All right. So we're going to begin with your head here. All right. So no lumps there. I'm going to kind of feel behind your ears. Down your neck. Okay. Any pain or anything like that? Okay, and there was no lumps, so we're good there. All right. And then I'm just going to take this otoscope and look in your ears, okay? That one looks good, and then I'm going to check this one. That one looks good. All right, and then if you could turn your head towards that way. Any pain when turning your head?
No.
Okay. No distension, so that looks good. And then if you could turn this way. Alright, so that looks good there. Alright, then I'm just going to feel your neck and feel the your pulse, okay? Alright. And then And then if you can close your eyes, I'm going to have you smell something for me, okay? Alright, so if you could just take a whiff of that. What'd you smell?
Simple.
Okay, perfect. Okay. And then I'm going to check your eyes really quick. Actually, before we do that, I'm going to have you follow this pin, okay? So you keep your head still and just follow the pin. So if you And then I'm gonna check your pupils, so I have to shine a light in your eyes, okay? That one's good. Okay, that one's good as well. And then I just gotta check inside your nose. I know that sounds funny, but I just gotta make sure there's no lumps or anything in there. Thank you, sir. All right, and then if you could open up your mouth for me, I'm gonna check and see and make sure there's no sores or anything in your cheeks, in the back of your throat. Can you lift up your tongue for me? All right, thank you. And then if you can say, I'm gonna use this tongue depressor, and if you can stick out your tongue and say, ah. Okay, and I'm gonna touch the back of your throat if you could gag for me. Okay, thank you. Now, if you can stick out your tongue and just kind of move it from side to side. Perfect. All right, thank you, sir. All right. Okay, and then I'm gonna press right on your forehead. Any pain through there? Okay. How about any pain down here? Okay, perfect. All right. And then I'm just gonna check your skin, trigger right here. Basically that just tells me if you're hydrated or not, which it looks like you are, so that's great. And then I'm gonna listen to your heart and lungs now, okay? So if you don't mind, I'm just gonna kind of pull down this blanket a little bit. Thank you. And then normally we would have stethoscope to skin, but for this video we're gonna leave your shirt on, okay? All right. So listen to that pulse for a minute. That was 64, so that's good. And then I'm going to listen to your lung sounds now, okay? And like I said, the same thing. Normally we would have it to your skin, but just for this video, we're not going to do that, okay? So while I'm listening to your lungs, if you could take a deep breath in through your nose, out through your mouth, and keep doing that. If at any point you feel lightheaded or need to stop, let me know, okay? Perfect. And then as I was doing that, I was also looking at your skin, making sure it was pink, warm to the touch. It was good. I didn't see any sores, so that's good. So if you wouldn't mind just to sit up for me, I'm going to do the same on the back side here. Take some deep breaths. Then you can go ahead and lean back. There was no sores or anything on your back, so we're good there. All right. And then if you can just kind of lay your arms out flat for me. I'm just gonna check the skin. It's nice and warm. It's pink. If you can kind of put your arms out like that for me. All right, and then push up on my hands. All right. How about pushing down? All right. And then I'm gonna have you squeeze my fingers as hard as you can. Okay, so I did notice some of that weakness like we were talking about earlier on your left side, but other than that, it seems okay. And then I'm gonna just, if you can hold your hands out just like this, I'm gonna pinch those capillaries in your fingernails just to make sure that it's good. Both of them are good. Alrighty, sir, thank you. And then I'm just gonna check your pulse on each one. Alright, they're good there. Alright, and then I'm just gonna listen to your abdomen, and then I'm gonna feel around on it, soft at first and then just a little bit more pressure as we go, okay? Alright. And same thing, normally your shirt would be up for this. Bowel sounds are good. Alright, so I'm just gonna feel around. You tell me if there's any pain, okay? Any pain? No? Okay, so then I'm just gonna press a little harder. Any pain? Alright, good. Alright, so now we're just gonna kind of pull this up there. And then I'm gonna check out your legs, okay? So is it okay if I pull this blanket up? Okay. Okay, so I'm just checking your legs. There's adequate hair on both legs. They're warm to the touch. They're nice and pink. No sores, so that's good. I'm just gonna check your pulse here. Both of them are good. All right, both of those are good. And then I'm just gonna pinch your nail beds on your toes just like I did to your fingers and just make sure that they're okay, all right? Okay, so those look good. I'm just gonna pull this down for you. All right, and so then I'm gonna just wash my hands. I'm gonna lower this bed. Here's your call light if you need it. I see that you have some water there, so I think you need any fresh water or anything. You good? Okay. And the remote's right there as well with your call light. And put your bed all the way down and put that guardrail up, that handrail. And I think we're good. Alrighty, sir. Well, thank you so much.